All right, I'm going to go ahead and kick things off. So thank you so much for joining us today. Really looking forward to diving into this topic. I think the good news, to report here is that this will probably be a slightly shorter session than what we were anticipating when we first thought of this topic, when we were still very much in the throes of COVID and the data was not looking good. Um, Fortunately, things are starting to trend in the right direction. Whether or not that continues to be the case, I think we're all hoping for a yes there, but always wise to be prepared for the worst. But hopefully this should be a fairly straightforward session, but just because the numbers are improving and the consensus when you poll people is improving doesn't mean that we're out of the woods yet, or that this is an easy decision for employers to make in terms of how to handle things like masks and vaccines. So without further ado, let's go ahead and kick things off. So for those of you who are not familiar with us, I represent MP. Wired for HR. We're a full service human capital management company. We offer HR advisement, payroll services, benefit admin, time and attendance, and compliance support, supporting businesses all over the country and all different industries. Very proud to partner with Delivery Association here to provide content and also HR support for members. My name is Paul Carelis. I am the Vice President of HR and Tax Credit Services here at MP, and really looking forward to diving into the content today. Couple quick housekeeping items. First, a brief legal disclaimer. Unfortunately, I'm not an attorney, so please don't construe anything I share today as legal advice, but rather some best practices from an HR perspective. Also, and this topic, probably more than any other, is quickly changing. So if you are watching a recording of this, just note that the information is current as of March 2nd, 2022, but constantly evolving for sure. And then the last housekeeping item, if you do have any questions, especially about this topic, but certainly while you have me here, if there's anything else HR related that I may be able to help with in today's session, please do use the Q&A function within Zoom. You should see it on your information bar there. Feel free to type in any questions you might have in the Q&A, and we'll do our best to get to those in the session this afternoon. So what we hope to cover today is just a overview of COVID-related legislation when it comes to employer requirements. We'll also talk about significant court rulings that have occurred in terms of when employees have challenged various policies at their employers and the success rate with those. That'll kind of naturally flow into what you can and cannot do as an employer when it comes to policies around COVID-19. We'll also take a look at state laws which make compliance especially tricky, especially if you have employees in different locations. We'll talk about some tips and tricks, especially for employers and employers within the transportation industry. And then, as promised, be sure to handle any Q&A that may come in. So first things first, we'll kick it off with legislation and the Supreme Court. So as you've almost certainly have heard, the vaccine mandate that was put in place via executive order by President Biden that would have required all private employers with 50 or more employees to require vaccines or weekly testing of their employees was struck down by the Supreme Court. The Department of Labor and OSHA, who was going to kind of be the enforcement body for that, did formally withdraw that, so it is off the table for right now, and they're supposedly working on something else, but we'll see. But as of right now, there is no vaccine mandate in place for private employers. The one exception to that, and this is also something that the Supreme Court weighed in on, was really the President Biden's executive orders around vaccine mandates were kind of three-pronged. So there was the one that everyone kind of heard about for the private employers. There was also one specific to the healthcare industry, so really any business that takes Medicare, Medicaid funding, so most healthcare settings. The Supreme Court also heard arguments about that and held it up. So um, if you have loved ones, if you have customers of yours, passengers who are in the healthcare industry and are talking about a vaccine mandate, that's why the healthcare mandate is in place, and in most cases does not allow for a testing out option. So they do indeed have to be vaccinated. The third prong was for federal contractors. So there may be some instances where within your livery operations you may be a federal contractor or do business for a federal contractor. So they had a mandate as well. That one was challenged and rose up to the district court level, has not yet been heard by the Supreme Court. What they did in that case was they did put the vaccine mandate aspect on hold. They said that, that they're kind of suspending the enforcement of that. But there were other aspects within that federal contractor mandate, things like masking, social distancing, other measures intended for a safe workplace for federal contractors. And based on the district court's ruling, those still apply. OSHA is said to be working on a permanent COVID safety standard. So it would kind of be a set of universal ground rules for how employers are expected to comply with various measures to ensure a safe work environment as possible as it pertains to the risk posed by COVID-19. They've said that that could be coming out in as soon as 3 to 6 months. When you talk to experts, though, the stuff that OSHA has released to date was all emergency standards, so those came out pretty quickly. To have a permanent safety standard on any topic generally has taken years rather than months to put in place, because there are very specific rules in creating a safety standard. It's similar to other Department of Labor rules. So it has to be released in draft form. Any comments from the public or questions or concerns have to be kind of vetted out and responded to. So in all likelihood, as much as unless they do some kind of special rulemaking that I'm not aware of, the placement of a COVID safety standard is probably quite a ways away. But certainly stay tuned if there is one that comes out, even if it is on draft form and creates an opportunity for some public comment. We will be sure to update our NELA resource page, which I'll talk about in a moment. And then also we'll be sending out information and probably doing a webinar on it. Another important thing to keep in mind is, while everything we've talked about so far has been at the federal level, there are many states and cities who have various COVID rules, whether that be mask mandates, vaccine mandates, proof of vaccination to enter businesses, things like that. With changes to the COVID positive case data, along with changes to CDC guidance, which has been updated as recently as a few hours ago in terms of best practices for contact tracing. They also, earlier this week, really revamped their kind of risk assessment and mask recommendations based on risk assessment. So things kind of transformed from 90% of the country being high risk to only about 30% of the country being high risk. And with that, if a area of the country is considered low risk, the CDC recommendation is that masks really aren't necessary in most cases for most people. So with that, many states, many cities, many local governments are reevaluating masking and vaccine requirements. So it's ever changing, but something to keep in mind for wherever you're doing business. So let's talk about some significant court rulings that have transpired since the start of COVID. So while the federal mandate has been struck down, it was considered a little bit of overreach. Many businesses, as you've probably heard, did create their own vaccine mandates, both before the White House introduced theirs as well as after. So while the federal all-private employer mandate was shot down, almost universally employers, with their own company level vaccine mandates have been withheld. So employees have challenged, they've sued a vaccine mandate by their employer, but pretty much everyone in the courts and, everything from state courts to federal courts, district appeals, all of that, have withheld, upheld rather, vaccine mandates. So, and that goes across industries, whether it be, Tyson Foods and manufacturing. The first one that really caught the mainstream was a hospital system in Texas, I believe in the Houston area. They were the really first significant challenge to the vaccine mandate. But the courts upheld that. They allowed the hospital to terminate employment for people who did not come in compliance with the vaccine mandate, and that was given the court's blessing. Similarly, similar action was upheld within the New York City School District, and probably, at least in terms of mainstream court cases, the one that would tie most closely to your industry would be within the airline. So several airlines created vaccine mandates. The one that received the most challenge was United Airlines. We're going to talk about that one specifically in a few moments because there were actually some successful challenges to certain aspects of theirs, but by and large, those vaccine mandates have withstood legal challenge. Other court cases that have not withstood legal test as much really have to do with accommodations, and more specifically the Americans with Disabilities Act. So there was a case where an employee sued their employer because they had a policy in place. This was back earlier in the pandemic when the CDC guidance was that if you test positive, you should be quarantined for 2 weeks. The company's policy matched that, but at least according to the employee, what happened was they tested positive. Company put them on the 14 days, but about a week and a half in, they started calling them back and wanting them to retest, wanting them to come back to work. The employee was still, suffering some pretty significant symptoms. And then I believe on day 13 in the specific case, the employee was terminated. They sued, citing that their COVID fell under Americans with Disabilities Act, that it would be considered a disability. The court in their case is allowing the case to proceed. So it's important to note that not every COVID case qualifies as a disability and qualifies as an ADA subject case. To really qualify as a disability, something has to be affecting on an ongoing basis a major life function. That being said, some of the side effects of COVID can qualify for that. If there are effects to the heart, severe restrictions on someone's physical abilities for a length of time, some of that kind of COVID fog that can diminish mental capacity for some period of time, all could potentially fall under ADA. There is a lot of gray area there. So if you do have someone who's got ongoing COVID limitations or side effects from having COVID, before taking any type of employment action, you really should consult a professional to make sure to decide whether or not there could be potential for protections under the Americans with Disabilities Act, because it really is on a case-by-case basis. Ultimately, whether it be this case or in any others, you should, in a best practice situation, follow current CDC guidance for both, whether it's shaping policies or handling a specific case as it comes up. The courts have generally sided in favor with employers who are following CDC guidance. We are also seeing a lot of cases out there for workplace discrimination and wrongful termination. So obviously many businesses were hard hit. The delivery industry is no exception to that. So as businesses had to make some tough decisions, oftentimes laying people off, terminating people, some of those affected employees felt that the company was making decisions based on their protected classes rather than because of COVID and the pandemic. So you're seeing lawsuits from pregnant workers, workers who are out on maternity leave and laid off or terminated, things like that. So very important that now more than ever, you're making a strong business case, even in an employment at will situation, as to why you're making an adverse action against an employee, and very, very clearly and officially mapping out your reasoning whenever possible. If it is a layoff because of a reduction in force, that you're doing that in a fair and impartial way, and to the best of your abilities, making it clear that a position is being eliminated or there's an overall reduction in force, and that to hopefully expel any thoughts from the affected employees that there's any type of discrimination or anything else that could be illegal in play. So as promised, I did want to touch upon the United Airlines case. So what happened with United Airlines was they issued a vaccine mandate for all employees, and terminated folks who did not comply with the mandate. And for folks who had a valid religious exemption or medical exemption, if that position was facing the public, so things like airline attendants, people that work the counter, pilots, anyone who may come into contact with their passengers or the general public, the way that they decided to accommodate people who had legitimate religious exemptions was to put them on unpaid leave until they deem the pandemic to be over and not be an issue for these people to return to work. So this was a court case where the district court came down pretty heavily on United Airlines. They said that the mandate as a rule is okay, but they felt that giving employees with a religious exemption the option of either getting vaccinated or going on unpaid leave was really coercion, kind of saying if you want to be able to put food on the table for your families, if you want to be able to maintain your livelihood, then you're going to have to get this vaccine or lose, go unpaid. So they felt like that was not a reasonable accommodation for the folks who had a legitimate religious exemption. So that one is still being sorted out by the courts. Basically, the court knocked it down to the lower court in their original decision and told them to kind of reconsider the circumstances. So the ink is not yet dried on this case in terms of what United Airlines is going to be able to do and how they can properly, reasonably accommodate people with valid religious exemptions. But it does show a ding in the armor to some of these policies out there and being very heavy-handed with the mandates. So this is definitely, especially within the transportation industry, a important case to keep your eyes on, as it will probably go a long way in shaping best practice and legal precedent for how to handle employees with exemptions, especially if they're in positions that are interacting with the public. So while hopefully many of you have seen COVID cases dwindle and cases within your employment population go away, we still are certainly seeing some pop up. So it is important to note that while federal COVID leave and reimbursable leave at the federal level has ended as of September 30th last year, there still are many states and cities who do have requirements that involve paid leave for COVID-related instances. So as of today, this is the most up-to-date list. So states and cities that do currently have COVID leave laws include Arizona, California, if you do have employees in California, even if it's one or two, but your overall nationwide employee count is over 26, you do want to take a special look at that. So even if you have a dispatcher or a salesperson or whatever it may be in California, the rules there are pretty strict, both in terms of compliance as well as posting and notification requirements. And most onerous is that the California COVID leave regulation requires you to put information on employee pay stubs, even if COVID leave isn't being used. So you have to have something on your pay stub or some other each pay period notification to let an employee know that there is COVID leave and they've used 0 hours of it. So this one is especially important and probably the trickiest to be in compliance with. So if you do happen to have anyone in California, or you have colleagues of yours out in California, you should let them know that there is a pretty hairy COVID leave law that just started last month. In California, there are also dozens of cities and counties that have their own specific COVID leave regulations you want to make sure you're in compliance with if applicable. And then Colorado, Massachusetts. So I know we do have a large population here in Massachusetts. There is still COVID leave required for you to provide up to 40 hours for employees. As of right now, that's through next month. It is reimbursable, but you do have to provide it and then go to Mass Tax Connect and apply for the reimbursement through the state. Other states with COVID leave laws include Nevada, New Jersey, New York City, the city of Pittsburgh, Pennsylvania, Washington State, and Washington, D.C. So, in terms of some tips for employers and how they can best navigate everything that's going on right now. If you do want or decide it's best for you to have a mask policy, you do want to be specific. What are the requirements? Are employees expected to wear those in public areas? Are they expected to wear masks in the office setting? When they're driving vehicles, when they have a passenger present, but they can take it off when there isn't a passenger present. You want to be as specific as possible with the masking policy. If you wish to, you may want to have something in there about passenger requests. So there may not be a general mask policy at your organization, but if you hear from a passenger that they're immunocompromised or otherwise wish the driver to be masked, if that's something you want to accommodate, you should write that into the policy. As mentioned before, you want to be mindful of any changes to CDC guidance and help that kind of lead the way a little bit. And then also be mindful of any local regulations, masking requirements, what have you, especially if you do have drivers who are entering airports, what the requirements are there, and just making sure that they're being compliant with the requirements in those locations. If you want to take things a step further and issue a vaccine mandate to your staff, first things first, you want to give a reasonable amount of time for employees to comply with it. So in terms of the vaccine mandates that have been legally challenged and upheld, we've seen most of those create a kind of a 60-day period of compliance. So from when the policy is announced to when employees have to be in compliance with it, a 60-day turnaround time has been kind of deemed as acceptable. As we've seen with the United case, you do want to allow for religious and medical exemptions. You also want to outline the process for how someone should go about claiming that. So there should be some paperwork involved. There was a medical center that kind of made it very easy for employees to claim exemption, and not to say you want to create too many barriers, but you don't want to make it overly simplified either. That can have a bad look and create some scrutiny. And it is also okay to kind of vary the policy based on legitimate business rationale. So again, if you want to have a different set of rules for folks who come in contact with your customers, that's generally okay. If you then want to limit it to, if you have people who work remotely or work from home or work in the office, you got to do it very carefully and be very nuanced with it. But there are ways to kind of have different rules for different varieties of employees. Some other tips outside of having specific mandates or policies. You are allowed to collect vaccine information even if you don't have a mandate. So you may in the course of business have a request for, I'd really prefer, or I need to have a driver who's vaccinated because I'm immunocompromised, or whatever the reasoning may be. And if you do want to accommodate that, it obviously would help if you had a kind of list internally of which employees of yours were fully vaccinated. So it is okay to collect that information or require employees to report that. What I will advise is don't pry for explanations if people aren't vaccinated. You may then kind of dive into requesting medical information or medical reasoning that you may not want to be privy to. It could create some compliance issues there, but it is perfectly acceptable to require all employees to report on their vaccination status. It may be a good idea to survey your staff. So in many ways, employers are kind of in a no-win situation here. If you have had policies in place about masking or about vaccination and you're thinking about lifting those, the country is still kind of split in terms of sentiments on that, whether people feel now is the right time, if people feel it's too soon. So it might be a good idea to get a pulse of your staff to see where their heads are at, and if you were to make some changes, how much of the staff may be negatively impacted by that or raise concerns about it. If any of you have allowed or utilized remote workers, obviously that's not an option for drivers and people providing transportation, but you might have sales teams, you might have dispatchers, you might have marketing folks, any other non-driving roles who may have been allowed to report remotely. It is, many businesses are starting to call people back to the office, wanting them to now report back to duty in the way that they were pre-COVID. I will just say, prepare yourself for some battle there. It's, the cat kind of got out of the bag a little bit. We opened up Pandora's box out of necessity. We wanted to maintain our businesses. We wanted to maintain a safe workplace, protect our employees, and be able to get the job done to the best that we could, given all of the restrictions and all of the rules we had to follow, and really all of the best practices when it came to not spreading disease. Unfortunately, this went on for quite a while. Some employees are going on now, close to 2 years of working remotely, and so it's a difficult ask in terms of bringing them back to the office. But that being said, many businesses are doing so. What we're seeing out there when that happens is, all of a sudden employees are saying, hey, I've got this condition. I don't feel it's safe for me to do so. I cannot return to the office because of this, that, or the other thing. So just prepare yourselves for some of those tricky conversations. The first and most important piece of advice is, if possible, have a job description that speaks to why you feel that the job is best done in person and can't really be achieved to the full extent remotely. Ultimately, it's your decision. If you want to just have people report to the office, that's your prerogative. This will more come into play when people have accommodation requests. So if they say, hey, I've got this condition, I've got this situation, I'm really best served by working from home. The more you can point to the job description and why you can't reasonably accommodate them working remotely, will help your argument greatly. So if this is a situation for you, again, just prepare yourselves for some conversations that are going to be difficult and not very fun. But the more you can base it on fact, essential functions of the job within a job description, and your business-related argument as to why you feel those are best done at your work location and not from home, will make that more objective, more to the point, and hopefully create less back and forth. You also want to make sure you're promoting any measures that you're taking in regards to COVID prevention, both internally and externally, certainly from a marketing and a business perspective. It's great for your customers and your potential passengers to know all the measures you're taking to make sure you're keeping them safe. But it's also important to make sure that's communicated to the staff as well. While OSHA has been somewhat limited in what they can enforce, I will say that the OSHA inspections we have seen have all been from employee complaints. So an employee reaching out to OSHA saying, my workplace is unsafe, my employer is not taking COVID seriously, they're putting us at risk because they're doing this or not doing that. And there have been cases where that's resulted in an OSHA inspection. So obviously we want to avoid OSHA inspections as much as possible. So the more you can do to show to your workforce as well as your customer base that you are taking COVID seriously and taking safety precautions should hopefully eliminate the risk for COVID and for OSHA inspections. I will say there was a court case where a group of employees in Pennsylvania felt that their employer was not taking proper precautions and creating an unsafe work environment. They contacted OSHA. OSHA came in, took a look at it, felt that what they were doing was sufficient. The employees went back and wanted OSHA to do more. OSHA said no, and the courts held that up. They said whatever OSHA kind of deems initially as a safe or unsafe work environment is good enough. So whatever the topic, one thing, my big keynote someday at a big conference somewhere is going to be that in HR, we also have to wear our PR hats at all times. So especially if there's a written policy, a written communication, whatever you decide to do around your measures that you feel are necessary or required in terms of masking, vaccines, general safety practices, make sure you're reading that over a few times or have some other people review it from a public relations perspective, because especially now in the information age, it is so easy for something to be misconstrued or to be sent out there to the general public on Yelp, on Facebook, on Instagram, wherever, that could make you look really bad. So you just want to kind of keep that in mind, that whatever we're producing in terms of policy or communications, if this was to be disseminated out to the general public via social media, via the local news, is this something that we're going to be able to defend and feel confident about? So whether we like it or not, HR, human resources is also public relations, in this day and age. So just keep that in mind, whether it be something COVID related or anything else that you're doing from an HR perspective. Also, don't be afraid to pivot. Again, CDC guidance is changing. I'd say public sentiment is changing. But at the same time, we are now seeing schools go without masks. Hopefully, everything continues on the path that it's on. But there is the chance that we could see another variant. We could see that the lack of masks in schools creates an uptick in COVID cases. So whether it be loosening your restrictions or tightening them up, don't be afraid to pivot based on what you feel is best for your business. I will say seek expert opinion before making any major changes. That's just always a good idea. We don't want to act too irrationally and sudden when it comes to making changes to policy. And then finally, just make sure you're keeping up to date with any federal or local regulations when it comes to COVID-19. These things are changing by the day and by the hour sometimes. So just make sure that you're keeping up with the compliance, especially if the momentum swings at all and things start to tick up and we do start to see more restrictions. You just want to make sure you're following all the rules that you need to as an employer and as a provider of services to the public. All right, let's see what we got for questions. Got a couple in here. I received questions regarding whether drivers should be required to be masked when driving clients. Should their clients be required to do so? Yeah, so in most cases, and again, sometimes city ordinances will take over here, but as a rule, there isn't, at the statewide level, there isn't a requirement for people to be masked in a private business setting. If you wish to do so, if you feel that's best, then you certainly can. But yeah, it is all a matter of what your policy is going to be. So that's up to you. You can have a across the board masking policy. You can have a masking if not vaccinated and can't show proof of vaccination policy, or masking if not vaccinated and or can't show a negative test within 72 hours or 24 hours. You really have a lot of options. You just want to make sure you have a policy and you're consistent with it. Another question here. Are we allowed to ask for vaccination status if not vaccinated, agreeing to weekly testing? Yep, so again, even though that federal mandate isn't in place and was shot down, the way that the decision was worded by the Supreme Court, it did not prevent employers from having their own private vaccination policy and requiring weekly testing for those who aren't vaccinated. That all would pass muster. In this example here in the question, there was someone who had received one dose but not the second. So yeah, I mean, work with the employees, especially if they're looking like they're trying to comply. If you can throw a test in there in the middle while they're waiting for their second dose, then all the better. But yeah, that is completely acceptable to have a vaccine mandate policy at this time to require testing for employees who are not vaccinated, especially if they're going to be coming in contact with others. I'd be a little hesitant on folks who are working remotely and not coming into contact with anyone else. Even the federal vaccine mandate, when it was going to be in place, did kind of exempt people who are working remotely unless they were going to be coming into the office or interacting with the public. So if you do have someone who's been working remotely and you do have a vaccine mandate in place, it's okay to exempt them from it. But if they're going to be coming to the office or going to be doing something, on behalf of the company, interacting with others, you can then ask for proof of vaccination or have them submit a test. All right, so it looks like those are our two questions. I did quickly want to just reiterate, NELA does have a specific website set up strictly for members at mp-hr.com/NELA, where you can submit HR-related questions that you have and get a response from one of our HR professionals. So whether it's about COVID-19 mandates, vaccines, restrictions, or anything else that you're encountering when it comes to the HR space and working with your employees or potential employees, please do submit a question there on the website that goes right to our HR team here at MP. I'd be happy to respond. Also, we keep copies of our blog posts and recordings of our webinars that we're doing there on that site. So please do take advantage of it. It's a great resource that NELA provides to its members. And I hope to hear from you all soon. Otherwise, stay tuned. We'll be doing another one of these sessions next month, and we look forward to it. Thank you very much and have a great day.